Dyspepsia is a term which is used when the doctor feels that the patient is having some abnormalities in the digestive tract, upper abdomen, maybe in the stomach or in the liver, gallbladder, in the upper area. So, dyspepsia is an umbrella term for all of these diseases which a physician or doctor assumes to be in the upper GIT origin. This is the dyspepsia term. So whenever the patient have these symptoms, they go to doctor, to general physicians or the gastro, and they label dyspepsia. So patient have confusion in mind. What is dyspepsia? They don't know. So just in this talk, we will discuss about dyspepsia. This is very common. In West, around 40 to 50% patient have dyspepsia, and in India, even 20 to 30% patients have this symptom or this diagnosis once in a while. Dyspepsia is of two types basically, the functional dyspepsia and the organic dyspepsia. So the organic dyspepsia is when there is some structural disease, there is some infection, some inflammation, ulcer, some stones or some cancer. The organic disease is there, that is the organic or structural dyspepsia. But in majority of cases, when multiple tests are done, when ultrasound done, endoscopy, CT scan, they all are coming normal, but still the patient keep on repeating these symptoms. So that is the functional dyspepsia. All the organic part are normal, structural part is normal, but the functionality is in a bit way not happening in the proper way. So this is functional dyspepsia. This becomes very important. Now, how we can have an initial idea that which dyspepsia is organic, which is functional. So just few points we will discuss. If any of these symptoms starts happening in a very elderly patient like 60 plus patient for the first time, patient having pain, early satiety or upper abdominal symptoms, first time 60 plus, very high possibility of organic dyspepsia. Secondly, if along with dyspepsia there is a weight loss in the patient, decreased appetite, there is fall in the hemoglobin level, there is continuous vomiting, blood in vomiters, or when there is a family history of any malignancy or any peculiar disease of GIT, then the possibility of organic dyspepsia is pretty high and we should not waste time. We should do early evaluation and rule out the organic causes and then accordingly treat. But if these symptoms are happening in very young age, less than 30 years, very frequently they are happening, they are mild and no very dangerous sign, then the pretty high is the functional dyspepsia. So sometimes we can take the liberty of getting symptomatic treatment for some time with the help of a doctor. Never over medicate yourself or self medicate yourself, because the implications are not very clear in sometimes. And if the symptoms are still increasing in functional group and there's any warning signs are coming, do get evaluated and properly make the diagnosis. So this is all you should know about dyspepsia.